So today we're doing an AlloFlo. I'm coming in. This case is not done using the spanula. Instead, I'm just using Provisc on the cannula. And so my goal here is to strum scleral spur. And as I strum scleral spur, I want to fall down into our space. And so I'm not trying to pull down. I'm just trying to push right through that space. And there you can see we've punctured through. I'm going to inject viscoelastic as I do this, and that helps keep that space open. It also tamponades any possible blood flow that might occur. Now, the easiest way to expand these, I like to do 2 stents, and I like my stents widely spaced from one another. So sorry, stents aren't the right word. My spacers. So when I put in my spacers, I want a big space in between them. I want at least 1.5 to 2 spacers worth of width. And so here you can see I've made a big cleft. I've got a little bit of blood reflex, which is completely normal. If you pull down at this junction to create your cleft, you're more likely to create this heme. The easiest way to do it is to really just inject viscoelastic and move laterally. And so during this procedure, I'm going to use more viscoelastic than I normally would because my goal is to continue to give you a good visualization of what we're looking at here. So we're injecting more Provisc. I do want to see kind of that white scleral wall behind this. Right now it just looks dark, but I'm pretty sure I give you a view here in a second where I tilt the eye a little bit so you can see that posterior scleral wall, which tells us we're in the correct location. And so now you can see the heme is pretty much stopped. We've got a nice visual of where we're going. I'm bringing in the first spacer here, and we're going to inject, and I want to keep about 1 millimeter of this spacer or scaffold in the anterior chamber. And so there you can see we've got about 1 millimeter in. I'm going to come back in again with a viscoelastic because I want to keep your view as clear as possible through this entire procedure to demonstrate what we're looking at. But you can see a big wide open space. Coming in with that viscoelastic, again, either usually Helon, GV, or Provisc, whatever they have available. So you can see the first spacer, and I like to not put my spacers just straight in. I kind of like to push them out laterally, and that way I'm holding open this like big scleral lake bed. Now where this case gets fun is right here. So that second spacer, I injected a little bit deep. And so I don't want it to stay that deep. We need to move that spacer back into the anterior chamber. The easiest way I found to be able to do this is you need to use MST Forceps. Not smooth, we're looking for serrated forceps. The smooth ones slip against that spacer, where the serrated grab it quite nicely and pull it forward for you. Take a peek when I do this. You'll see that white scleral wall when I bring in those scleral MST forceps. When I pinch that scleral tissue, I don't want to smash the tissue. I'm going to very, very lightly pinch it and just grab it enough to bring it anterior. I don't need a giant purchase area to do that. And so here in a moment, she's loading up the MST forceps for me right now. Hopefully I recenter before we do this. I think I do. Yep, there we go. And so here come the MSTs. Again, they're serrated. I'm just going to very lightly, you can tell right when I get a hold of that spacer, I'm barely squeezing. I'm not fully smashing them, and I'm just bringing it forward enough to where you can see it. And there you go. Big, wide, open cleft. Thanks for taking the time to watch this video.